Good afternoon and thank you for joining us. My name is Karen McConaughey and I am a periodontal therapist at Ivory Dental Studios here in Niagara Falls, and I have the pleasure of introducing our speaker for today. A graduate of the University of Detroit Mercy School of Dental Medicine, Dr. Harjeet Gill is very proud to provide all aspects of comprehensive dentistry to the Niagara regional community. She is passionate about providing excellent personalized dentistry to her patients and strives to provide gentle and customized dental services. Dr. Gill continues to be a lifelong learner. She is an active member of the Dawson Academy, the American Equilibration Society, the Bale-Dineen Method, American Academy of Oral Systemic Health, and other institutions for continued education. Dr. Gill has advanced knowledge and training in the temporomandibular joint, disorders of the temporomandibular joint, bite disorders, and sleep apnea. She approaches dentistry with accuracy, precision, and artistic perspective. Outside of her profession, Dr. Gill strives to maintain mindfulness in her life and loves being a wife and mother to her 5 children. In her free time, Dr. Gill truly enjoys cooking and reading, and most of all, spending time with her family. Ladies and gentlemen, Dr. Harjeet Gill.
Thank you so much, Karen. Now let me tell you a little bit about Karen. As a registered hygienist with more than 25 years in clinical setting, Karen engages her clients to be partners in their oral health. Outside of her clinical role, she enjoys time with her husband, 2 children, and her dogs, often tinkering in the garden or cooking. Colleen, our care coordinator at Ivory Dental, joins our team with 25 years of customer service in the automotive world. While dentistry and automotive are worlds apart, but Colleen's forte and excellent customer care makes her a very valuable team member. Ruth, our clinical dental assistant, with her 25 years in clinical assisting, brings her calm and controlled composure that's sure to put your mind at ease during your visit at Ivory Dental Studio. We're located at the intersection of Dorchester and Lundy's at 5932 Dorchester Road, just minutes away from Costco and Walmart Supercenter. Have you ever felt tired after sleeping in and even getting 8 hours of sleep? You might have thought to yourself, I'm just not a morning person, or I've just not had my coffee yet. Today, I'm here to talk about an underlying condition that could be causing your chronic tiredness. Guess what? It all starts with the mouth. We all know the importance of sleep. After all, we spend 1/3 of our lives sleeping. Sleep is an essential function that allows your body and mind to recharge, leaving you refreshed and alert when you wake up. Healthy sleep also helps the body remain healthy and stave off diseases. More specifically, sleep helps with weight loss. It can improve your concentration and productivity. It results in better physical function, improves heart health. It regulates your hormones, prevents type 2 diabetes. It improves depression and anxiety, supports a healthy immune system, reduces systemic inflammation, increases your ability to interact with others and have healthy relationships. And it also prevents motor vehicle accidents due to sleepiness behind the wheel. So what could get in the way of getting a good night's sleep? There's many conditions that can keep you from getting your full uninterrupted sleep, like restless leg syndrome, insomnia, narcolepsy. But today, I'm going to be focusing on sleep disordered breathing. What is sleep disordered breathing? Sleep disorder is an umbrella term for issues with airway causing impaired intake of air during sleep. There's a spectrum in breathing disorders. When you have a normal airway, you don't have sleep breathing disorder. But when that airway is narrow, you have moderate sleep breathing disorder. And when that airway is closed or obstructed, you are in the most severe, you have the most severe form of sleep breathing disorder, also called obstructive sleep apnea. So does your normal airway change into narrow airway? You may have seen kids or even adults sleeping with their mouth open. Mouth breathing leads to inflammation of oral tissues. When you cannot breathe through your nose because of allergies or chronic sinus infections, you tend to breathe through your mouth. Breathing through your mouth, you're taking in cold, dry, unfiltered air that irritates the oral tissues. And as you can see, the airway gets obstructed with swollen adenoids and swollen tonsils. You could be a mouth breather if you feel you have difficulty breathing through your nose, you're not experiencing restful sleep, your lips are constantly chapped, you wake up and cannot fall back asleep, and you snore throughout the night. So what happens with constricted or narrow airways? When the air flows through narrow airways, it increases the velocity of airflow that you hear as snoring. The pressure drops and you're at an increased likelihood of getting an airway collapse. Don't think you snore. You can't really tell because you're sleeping, but you can download the simple Snore Lab app on your phone and record your sleep for a week. I challenge you to send me your scores after a week, and you might be surprised. What is sleep apnea, and how does this happen? Air is important. We can survive without food and water for days, but without air, we cannot go more than 4 minutes. You know, in 4 minutes, the brain cells start to die. So what happens during sleep? During sleep, your muscles relax and gravity takes over. Your tongue falls back into your airway, obstructing the airway. The oxygen cannot flow in freely and carbon dioxide levels start to rise up. And you wake up gasping for air. What are the symptoms of sleep apnea? Interrupting of sleep during sleep, interrupting of breathing during sleep, falling asleep during the day, restless sleep, loud snoring, waking up irritable or staying irritable throughout the day, forgetfulness, anxiety, depression, morning headaches, mood, and behavior changes. If you suffer or have 3 or more of these symptoms, I would advise you get yourself checked for any airway obstruction. Your dentist will start screening you for airway obstruction by giving you a simple questionnaire that asks questions like, do you snore loudly? Do you often feel tired, fatigued, or sleepy during the daytime? Has anyone observed that you stop breathing or choke or gasp during your sleep? Do you have or are you being treated for high blood pressure? Is your body mass index more than 35 kilogram per square meter? Are you older than 50 years? Is your neck circumference greater than 40 centimeters? Are you a male? If your answer comes out to be having 3 or more, you're at an increased probability of having sleep apnea. Your dentist will further do a comprehensive exam looking at your Mallampati score, which, as you can see, moving from class 1 to 4, class 4, there is a complete obliteration of your airway. Your dentist will also look at tooth wear, narrow palate, scalloped tongue, and might also give you a home screen testing device which will confirm any kind of airway obstruction during sleep. To get an official diagnosis on sleep apnea, your dentist will now collaborate with your physician, who will send you to a sleep lab for an overnight sleep study. So now that you know what sleep apnea is, let's see how it is treated. Treatment is focused and depends on where the obstruction, what's causing the obstruction. Early intervention is the key. As a kid, if this gets screened earlier as a kid, we can very simply expand.
Sorry for the technical disruption. We'll pick that back up.
So as I was saying, early intervention is the key, and if it gets picked up early on, we can look for narrow palates in the kids, which are easier to expand using a very simple tooth-borne device. As you can see, the mid-palatal suture in a kid is pretty simple and straightforward. In a 15-year-old, it gets a little intertwined, and as an adult, it gets quite intertwined. In order to expand the palate in an adult, we need mini implant-assisted palatal expansion device. Can you spot a difference in those two images, pre and post expansion? If I look at it, I look at the two black and white gray images. The one on the left shows how one of the sinuses, maxillary sinuses, is congested, and as soon as the expansion takes place, the sinuses start to clear up as a side effect of palatal expansion, and that's a good side effect to have. Now, snoring, long-term snoring, if somebody's been snored night after night, it has an impact on your soft palate, which gets floppy and flimsy. So you can use, with the use of night laser, you can generate new collagen and tighten up that soft palate tissue. It's a very fast and comfortable procedure, 20-minute walk-in, walk-out treatment, and can also be done without the use of anesthesia. But sometimes you cannot achieve treatment with simply orthodontics or with laser, and you may have to resort to surgery where your upper and lower jaw has to be repositioned in order to correct the airway. Now that you know the treatments, and some people may still have reservations of going through long and surgical procedures and may just want to manage their sleep apnea instead of treating it. So with the help of your physician, your dentist can make you an oral appliance which pulls the lower jaw forward, opening up your airway. CPAP is still the gold standard in management of sleep apnea. For mild to moderate sleep apnea, it can be managed with an oral appliance. But for severe sleep apnea, you do need to go back to your gold standard CPAP. Sleep is just as important as nutrition and exercise. Lack of sleep is associated with many negative health effects, including increased risk of heart disease, depression, weight gain, inflammation, and sickness. Bottom line is, the best eraser in the world is a good night's sleep. Thank you. If you have any questions, you can send them off to now. I'll be happy to answer any of your questions now. Thank you, Carol. So Carol, I need this, but surgeons.
Carol was recommended a surgical correction.
That's right, Carol. So for definitive treatment, your oral surgeon probably has seen if you have retruded jaw, narrow palate, and your jaw is set back, they may have to do that in order to reposition. The position of your jaw can really be corrected through surgery. There's no way we can expand the jaw. We can expand the narrow palate, but we cannot change the position of your jaw. So if the position of the jaw is compromised, then a surgical intervention is needed. But I'll be more than happy to see you at our clinic for a second opinion and explain you further, look at your jaw and explain further as to why you have been diagnosed and told to have a jaw surgery.
I think that's all the questions that have come in. If anyone else has any questions, please feel free to put them onto the chat now. Otherwise, you can email us any of your questions at office@ivorydentalstudio.ca, and we'll get back to you as soon as we can. All right, ladies and gentlemen, thank you for joining us today. Again, if you have any questions at all, please send us an email at office@ivorydentalstudio.ca, and we'd be happy to speak with you a little bit more about sleep apnea and how it impacts your life and your oral wellness. Thank you.